Picture this, you are stuck in traffic and fumes billow from the automobile ahead or next to you. The fumes that you inhale in that environment contain particles smaller than the width of your hair and are capable of causing serious health problems. Unless, of course, you're fitted with an oxygen tank, but how many people are? Exposure to such pollution is silently killing thousands of people, according to the United Nations, which says about 14,300 Kenyans die annually due to health conditions related to air pollution. Margaret Wanjiku tooled around the city in search of answers.
Nairobi City County for a greener and cleaner city. Words that attract one's attention as you drive or walk along Kenyatta Avenue. But this is a far cry from reality in the green city under the sun. All manner of automobiles circle around the city, leaving an atmospheric cloud of harmful smoke in their wake. The United Nations says traffic congestion accounts for up to 53% of air pollution in the city. Professor Michael Gatari is an environmental scientist at the Kenya Institute of Nuclear Science and Technology. He says the risks are many for city dwellers.
The increase of vehicles in Nairobi from the 60s to now is enormous. The emissions from motor vehicles currently in Nairobi are the major contributor of the content of particulate matter.
The emissions contain very fine particles which are invisible to the naked eye, referred to as particulate matter or PM. PMs of more than 10 micrometers can be filtered by the nose, while those below 2.5 micrometers, which are the most common in the city, cannot be filtered and go down to the lower airway. Exposure to such very fine particles is a big risk factor in Kenya. The full effect cannot be understated.
Some of the headaches, the migraine headaches you get, some of the breathing problems, people who have already got asthma even in worse cases, and probably some of the deaths which happen during the inversion periods when pollution is already closed on the ground are related to air pollution.
Aside from the high levels of concentration, Nairobi is also at a disadvantage as it suffers from inversion.
Inversion is when everything on the ground is closed and it doesn't disperse. So all the emissions from vehicles, you find sometimes you wake up in the morning and the air is too heavy because over the night the air has not been dispersed properly.
The World Health Organization has developed the Air Quality Index, which tells us how clean or polluted our air is and the associated health effects.
And what this measures is PM 2.5 and carbon dioxide. And the nice thing about this, it has a visual indicator. And the visual indicator gives you a visual idea of the level of pollution.
Nairobi City County says it has adopted this technology.
For example, we are having 3 monitors along Ruthuli, which we have had after we redesigned the road along on Ruthuli Avenue, which has really given us data.
Most city dwellers are concerned about the quality of air they breathe.
Kweli inatuadhiri sana, na ukiangalia magonjwa ambayo yanayoambukizwa kupitia kwa hewa, wengi sana wamekuwa siku hizi wakifungana kifua kwa sababu ya pollution ambayo tumeona katika mji mkuu wetu.
The government has introduced a new policy to cut the age limit for imported cars from 8 to 5 years in a bid to reduce the carbon emissions by older automobiles. This is part of Kenya's commitment to cutting its carbon footprint by 30% by the year 2050. But a tussle with the Kenya Auto Bazaar Association has left the intervention in limbo.
Even as the county government is doing its part to reduce emissions in the city, car owners can also do their part by switching off the engine when the vehicle is idling or even opting to take public transport instead of their personal vehicles. Margaret Wanjiku, NTV.